welcome back to my channel, and today we're gonna go over some NCLEX style questions, but more specifically we're gonna go over select all that apply questions. Now originally this video was like 30 minutes long, but by request from Facebook and Snapchat you guys told me to split it up in parts, and that's what I'm gonna do for you. So this is going to be part 1 of 3 videos to go over select all that apply questions, okay? So make sure at the end of this video that you click on the link below in the description box, okay? I'm gonna put the link below there, so after you're done reviewing the first part of this video, you go to the second one and so forth, okay? So without further ado, let's just get started, all right? Okay, so let's take a look at number 1. The clinic nurse educator is developing a teaching plan for the following 6 clients. The nurse should instruct which client to avoid the Valsalva maneuver when defecating. Select all that apply. I haven't put up any answer choices on the whiteboard yet because I really want you to focus on the question. So, what is the topic of the question? That is the first thing that you want to ask yourself when you look at an NCLEX question, okay? So, the topic of the question is the Valsalva maneuver. So we know by definition the Valsalva maneuver is straining while passing stool. Okay? And then the next thing that you want to do is find out what is the question asking. So before I even look at the answer choices, look at the topic, see what the question is asking. Now that I know that I have to tell some patients, whoever it may be, because it's a select all that apply question, you need to avoid this because ... So we have to fill in that blank, okay? So before I look at any of the answer choices, I'm gonna write a quick list right here. Which patients do I know have to avoid this, the Valsalva maneuver? So let's write a list over here. What do I know? Heart disease? Patients with heart disease possibly, maybe like patients who are post-MI, right? Maybe recent eye surgery because that would increase intraocular pressure. Intraocular pressure. And what else? Patients who have a head injury, because it will increase ICP, intracranial pressure. So that's a pretty good list to start off with, okay? Now let's take a look at our answer choices. Okay, so here are the answer choices. If you want, please pause the video, answer it for yourself, and then we'll go through it together. So now let's go through the question together. Anytime I have my answer choices like this and I've read through all of them, I first ask myself, which one am I going to eliminate first? Number 2, a 30-year-old woman recently hospitalized for reconstructive augmentation mammoplasty. What is this procedure exactly? So a mammoplasty, right over here, let me underline that for you guys. A mammoplasty is to change the size, shape, or position of the breast, and to augment something means to enhance or to enlarge. So basically it is to enlarge or enhance the size or shape of the breast tissue. Would this pose a risk factor if the patient did the Valsalva? And no, it wouldn't. This would actually be eliminated. The only thing that you would want this patient to avoid would be any extraneous activities after this procedure. Now the next one that I would eliminate would be number 4. A 68-year-old woman recently diagnosed with pancreatic cancer. This patient would not be at risk for doing the Valsalva maneuver. So number 4 would be eliminated. The only thing that you want to be aware of with pancreatic cancer is definitely nutrition. You would want this type of patient to avoid heavy meals. They would typically be on 5 to 6 meals per day. Avoid greasy, fatty foods, because remember, the pancreas secretes enzymes to aid in digestion of what 3 things? If you guys remember, say it loud and say it proud. We have protein, fats or lipids, and carbohydrates. So nutrition plays a huge role for patients with pancreatic cancer. So that's what you would want to watch out for. So looking at number 1, 3, 5, and 6, do those look good to you? I think so. Number 1, that would be a correct answer. Where's my red marker? That would be a correct answer. Head injury, where is that? Right over here, because of that poses the risk of increased intracranial pressure. Intracranial pressure, ICP. And then number 3, a 56-year-old man 2 weeks post myocardial infarction. Yes, that's on our list. And you know why? I think it's really important to explain why. For a MI, I want to draw the picture, so I'm going to draw it right over here, you guys. For an MI, while you're doing the Valsalva maneuver, it puts a lot of pressure on your chest, so it increases that pressure. But what more importantly happens is that it decreases blood flow to your heart. To your heart. And then what temporarily happens is that it decreases your heart rate and cardiac output. You think that that's going to be important? Let me move this board up a little bit, you guys. I'm sorry. You think that that's going to be important with someone that has a MI? Of course it is. So that's why number 3 would definitely be a correct answer. Let me move this down again. Now the next correct answer is number 5. A 74-year-old man with portal hypertension related to alcohol-induced cirrhosis. Oh yes, even though it's not on our list, what just gives it away? Cirrhosis, right? Scarring of the liver. And this poses a huge risk factor, which is variceal bleeding. Because the Valsalva maneuver not only puts a lot of pressure on your chest, but also your abdominal cavity. Number 5 is a good answer. Now let's take a look at number 6. A 82-year-old woman 1 week post-cataract surgery. Yes, that's also on our list. Be very careful with this one too, post-cataract surgery, because of the increased intraocular pressure, but also patients with glaucoma as well. Typically they put them on a stool softener like Colace. I think the whole hospital is on Colace, but this was a really great question. So the correct answers are 1, 3, 5, and 6. Alright you guys, for part 2 of this video, make sure that you click on the link right over here if you have a laptop or desktop computer. If not, that's okay. The link will be in the description box below this video. So check it out for part 2.